Hello, my name is Sarah Shoemaker, and I completed my test review on the Goldman Fristoe 2 test of articulation, which is also known as the GFTA 2. This test was created by Dr. Ronald Goldman and Dr. McLean Fristoe. Its primary purpose is to provide speech-language pathologists with a systematic means of assessing an individual's articulation of standard American English consonant sounds by sampling both spontaneous and imitative sound production using single words and conversational speech. So basically this means the test is used to test individuals' consonant sound production. It is intended to test individuals 2 to 21 years of age, and as potential users, you can expect the GFTA to cost you about $282. The components of this instrument include an easel, which contains all of your information for your subtests, the GFTA2 manual, the 25 response forms to record your client's responses, and a canvas bag to contain all of those components. This test was standardized by using a group of about 3,500 males and females, 51% males and 49% females, which ranged between 2 years and 0 months old through 21 years and 11 months old. And these individuals were pooled from the 4 major regions of the United States, and their ethnicities consisted of African American, Hispanic, white, and other. The validity for this test, we had construct validity in the sound and words subtest measure. It measures the ability to correctly articulate consonant sounds, which is measured against a developmental progression norm table, which is provided in your manual. The content validity, there's 23 of 25 standard American consonant sounds, and the other 2 were not used because they have a low intervention priority rate. For retest reliability, there was a score of 0.98 for initial, medial, and final sounds. In the internal consistency, the female population had a reliability score of 0.96, and the male population had a reliability score of 0.94. So as you can see, this test is both valid and reliable. The steps for administering the GFTA: first, you must prepare by reading over the manual, and it is absolutely vital to rehearse the directions so that way you can accurately and distinctly articulate the words yourself for your client. You must acquire a quiet and well-lit room for you and your client to sit at a table to administer the test, and you have to fill out the identifying information for the client in this response form to the right of the PowerPoint, including their name, their gender, and you must calculate their chronological age. This is an untimed test, but it typically takes between 5 and 15 minutes per subtest, and the examiner can administer all 3 subtests or any combination of them depending on the purpose of the assessment. The first subtest is sounds and words, which consists of 34 pictures with 77 consonant sounds. The client should be facing the picture. As seen on the left of the screen, you have a picture of a house and a tree, while the examiner looks at the side with the target words, which is shown to the right of the screen. Examiners will point to the picture associated with the target word and ask the client, "What is this?" The client will hopefully say it correctly. If not, then the examiner should identify the picture with a word, say a sentence without the word, and reprompt for the target word. And afterwards, you will record your client's response. This sample is used to examine the examinees' articulation of consonants against standard correct production and determine the type of errors and their consistency. Sounds in sentences has the same use as sounds in words, but for connected or spontaneous conversational speech. The examiner tells a story associated with the picture, as you can see on the PowerPoint with the boy playing a drum next to a ball in a wagon, and asks the client to retell that story, and then the examiner records the client's response. Stimulability tests only the sounds previously misarticulated in the previous subtest. The examiner will model the correct articulation and ask the client to imitate on a sound, word, or sentence level. This is used to determine the severity and a treatment plan for your client. The scores for this test include a raw score of 28, percentile ranks of 8%, standard scores 75, and age equivalent - grade equivalent scores of 3 years and 1 month. The limitations and cautions to consider while administering this measure is that it's difficult to interpret raw scored data because you cannot compare it to other tests, which may use different testing questions. And it's also important to remember recording spontaneous and conversational speech in sound and sentences isn't always controlled because while they do their best, it is still spontaneous speech. The examiner needs to be well rehearsed to not inaccurately pronounce or duplicate directions, words, or sounds. And when testing individuals with special needs, it's important that you require a sensitivity and realize that there may be inconsistencies in your testing. So thank you very much for listening to my overview on the Goldman Fristoe test of articulation.